Okay, let's start. You all know me. I'm Michael Dahlberg. I'm a colorectal surgeon. We're going to talk about surgical video editing today. We're going to edit a video live. We're going to make one here. It's a video I have not previously edited. I picked one that doesn't have a lot of steps so that it's easy for us to do it here. I'm going to show one short, already edited video to give you an idea of what we're going for. I chose a video from Ascars because Ascars is the toughest one to edit for because their length is 4 minutes. And it's very difficult to edit anything into 4 minutes. This video shows multiple surgeons working over the course of 9 hours, I don't know, to do an abdominal perineal resection robotically with a rectus abdominis flap to fill in the defect in the pelvis, okay? And so editing that down to 4 minutes is a difficult task. So this is the video, and I'm just going to let it play, hopefully with sound. No sound yet, but we want the sound. Please hold. Do I have to unmute to let my computer show its sound? No. It's okay. If we have to show it without the audio, then so be it. Okay, just pretend the audio is playing. So this is a very long video. That was her exam pre-op. It looked like Crohn's disease, but those biopsies ended up showing malignancy. But she had fistulas, so I put in cetons. I'm just going to live narrate it. So this is the ultrasound. It shows a T4N1 rectal cancer, and she was set up for total neoadjuvant therapy. I don't know if it's following me. This was her scope after treatment. At one point, she did get to need to be diverted with a colostomy because she was partially obstructed. So she needed a hysterectomy first. So the gynecologist did that. So this is what I was concerned about, by the way, by not doing it locally. This is because it's streaming. On my screen, it looks great. All right. So ignore the fact that it's a little bit jumpy. So what is the first thing you're seeing here about the speed? What are you noticing about the speed? Yes, it's very fast. So obviously, I'm not working that quickly. That would be insane. Right. So the reason it's so fast like that is because you only have 4 minutes for Ascars. And so we're trying to show a very complex procedure. You have to speed it up. So we're going to do that today. I'm going to show you how to do it. We're going to be using Final Cut. Okay, that's what we're using. So the APR portion, the abdominal portion of the APR, has now been completed. Now this is Dr. Seaver using the robotic scissor to do a harvest of the rectus abdominis on the right side. So he incised the peritoneum all the way up to the costal margin, and now he's releasing the flimsy attachments and just releasing all of the attachments to that muscle, because eventually what we want to do is we want to flip it down into the pelvis and just have it being maintained by its blood supply at the epigastric area. So he's working. We did ICG, the muscle is viable. There's the vessel sealer that I used to do the rectal resection, just coming across the rectus at the costal margin. So you're in the right upper quadrant at that point. And so now just the lateral attachment of the muscle is just being taken down so that the muscle is essentially free, except still maintaining its blood supply down lower in the pelvis. And so you just have to be careful not to take its blood supply, which there you go. So it's around that area. That's just using the port closure device that I like to use called the crossbow. That was my right lower quadrant 12 millimeter port. I closed it then because this is me now. He had to leave and go do a case. So I had to sit here now and reclose the peritoneum. So I'm using a V-lock suture to reapproximate the peritoneum and whatever fascia might be there, to cover the area where the rectus abdominis muscle was harvested from. So, even with a long VLOC, this is a very long area of geography to work in. So this took multiple sutures, but it comes together very nicely, so you won't get any sort of like weird hernia or anything like that. It really looks very nice. And just being careful not to close it too tightly down in the right lower quadrant, because you don't want to create ischemia where the blood supply is going into the muscle. So, and this is sped up also. When you're speeding up videos, you have to really look at what you're doing and say, all right, is it fast enough that I can show what I need to be doing, but is it not so fast that you look at it and you're like, I don't know what's going on? And that happens, and you have to play with it. So you might go at 200%, you might go at 300%. And so this was just showing the closure. We had the plastic surgeon do a gluteal advancement flap. She did well, and so that's that video. So that's a lot of surgery, but shown in 4 minutes. So that's the goal, okay? So let's start with there. All right, great. So now I will go into presentation format for a few minutes. All right. So I've presented approximately 25 individual videos over the last 10 years. That doesn't include the other little ones that were put together for other conferences and such. So about 25 individual unique videos. It takes, I would say, on average, about 40 to 50 hours to create one of these. So it's a long process. So you need to give yourself time when you're getting ready for a submission. You need to look at when the submission is due, and you need to make sure that you give yourself enough time to get the work done. The goal here is that you guys are now going to be doing this, okay? I'm passing the baton to you, okay? I'm done, all right? So the people at the research meeting a couple weeks ago, they already know this. I'm done. I'm retiring from short form videos. This is not what I'm going to be doing anymore. I'm moving on to something else, which you guys will maybe see at some point, a longer form, a more detailed representation of what we do to try to make us all famous, because I want us to be kind of the repository of surgical knowledge for people across the country and across the world. Because my feeling, why do I do this? You can do all of your submissions that you want. You can comb the desert like in Spaceballs with your programs that you use to comb whatever databases that you have access to. And what are you really doing? You're just combing the desert of all the stuff that other people have done, and you're popping out answers that honestly I think probably people have already done, okay? Great, that's fine, go for it. But here, this is how I learned to do what I do, okay? When I was a fellow, I would sit at night, and there was not nearly as much stuff on the internet, but I would find whatever I could find, and I would watch these videos over and over again, and then I would record myself operating, and I would watch myself doing it. I think that this is higher impact than a lot of the other things that you guys are submitting. I'm not saying not to do those other things, that's great. But if you want to talk about real impact, a real live surgeon is going to watch these videos, and they're going to change their practice. You know that move that I do with the anvil, that I put it in the body and I pop it out through the colon? I learned that from watching YouTube, okay? And so I'm clearly not the only one who's out there willing to do something like that. This is high impact. You can change someone's entire career pathway by making these videos. We're just a healthcare system in South Florida, but we do a lot of cool stuff. So we can record it. So all you have to do is go into the operating room, press record, because you never know what's going to happen. So press record. Okay, these are the steps. So let's start doing it. I'm going to open Final Cut. Forgive me, this is Noah's computer. So, punk soup. I don't know. I bought it a long time ago. You know, talk to your representation. All right, see if they'll be willing to buy you the equipment. Okay, so I have now opened up Final Cut. All right, so this is Final Cut. Yeah, okay, you can see it well enough. So this is the screen that you get to first. So step one, all right? Step one, we need to create a new event. So what you do is you go into File, you go into New, and you go into Event. And it comes up with the date. That's how it just initially places it. So let's just call it, what are we going to look at today? It's a case of a person with Crohn's disease with ileal disease, but not terminal ileal disease. So a right colectomy was not required. We're going to look at a small bowel resection being done for Crohn's disease. So we'll call it Crohn's disease robotic ileal resection with ICA, intracorporeal anastomosis. So you want to call it something that, because, you know, if you look at my computer, there's 100 of these. So you want to call it something detailed so you know what that one is. All right. And I'm going to, I don't usually do this, but I'm going to do it now. I just clicked create new project, and let me show you what that does when you click that button. So if I had not clicked create new project, is it following me? I didn't turn it on, that's why. It's recording. There it goes. Okay, it's recording, right? All right, it's recording. It just wasn't following me because I didn't turn the tripod on. Now it's going to follow. Hey. Hi. Okay. All right, so let me show you what I did here. The top of the screen, that is where you're going to import all of the media that you're going to use for your video. Your video clips, any photos that you might want to include, and we're going to get into all this. You're going to make PowerPoint slides, but those PowerPoint slides cannot be directly imported into Final Cut. Another step that we're going to talk about, you have to turn all of the PowerPoint slides into JPEGs. We're not going to be able to create a whole video. We're going to go through the steps and create enough of a video so that you understand. But I'm not stopping at, we're going to at least 1150, okay? All right, so on the top, that's where you import all the media. I'm about to show you how to do that. On the bottom, this part where it says untitled project, that is what opened because I clicked that box that said create new project. Had I not done that, I would have had to do that now, like separately. But the project is where you're going to drag all the stuff from the top to this. This is now going to be your timeline. Is this making sense? So you have, let's say, 4 hours of surgery. You're going to be choosing little bits of it from the top and dragging it to the bottom. And that's the first step. That's your first step in editing. You're going to take bits of the main and you're going to put it in the bottom, and that becomes your timeline. Now, the first time you do that, it's going to be 45 minutes long, or it's going to be an hour long. But you started with 5 hours, so you've made headway. And then you do the fine editing, which we'll get into. So the next step, you have to import your data into the top box here. So import media. So I clicked that. So I'm going to go to right here. So it gave me, I had already used this before, so it went directly into the directory where I had it. But if you had to, you could just choose which directory. So now I'm going to double click that. And so look what happened. This is the entire video. Look, it's following me. This is the entire video now up on the top. And I can't remember what that box is called, but let's just say that's where everything is, okay? Everything is now up top. But remember, where we're really going to be working is on the bottom, all right? Now, I do this with a trackpad. That's just because that's how I got used to doing it. I have one of those magic trackpads on my desktop, similar to what you have in a laptop. But you could use a mouse, and that would be great. All right, so look what happens now. As you drag, see what's happening? See that so as I drag, I'm seeing what's happening on the screen. Yes? Okay. So here, what I do is I drag, okay, so let's do this. That's like, okay, we're in the abdomen, we're just getting started. So I highlighted that portion, I'm now going to drag it down. There, we have now added something to the timeline. We have begun to create a video. So now this is the stuff that is what we're going to be making the video from. So what I do is I just keep dragging here. And so now I've started making the incision in the mesentery. So, I mean, we can talk a little surgery while we're doing this. What have I done there? I looked at the disease and I said, okay, the disease starts here and the disease ends here. So what are we going to do? We're going to remove everything in the middle, right? Yeah, so let's dumb it down because, I mean, surgery is not that difficult. So that's our area of proximal transection. All right. So I'm making a window in the mesentery. I've gone right here. I've gone full thickness. Okay. And so now I'm marching towards the distal end. Now it's possible that some here I already chose the distal end. I'm not really sure. I'm probably just marching along. So what are we doing here? We're using the vessel sealer to take the mesentery of this bowel fairly close to the bowel wall, because this is not cancer, right? So we don't need to be taking all the mesentery. Now, because I want to teach you, since we're doing this, we might as well not just do video editing, let's teach a little bit. Crohn's disease can be scary because the mesentery can be involved, and it can be very fibrotic and like woody almost. It's like made of wood. And so a place where you can get into trouble in these cases is right here, where you're coming across the mesentery and you're trying to seal it, and then all of a sudden, blood everywhere. So, go slow. And if you think that the mesentery is super bad, then you can go lower in the mesentery where the disease has stopped. Then, of course, you're dealing with much bigger vessels in the central mesentery. You're getting potentially closer to the retroperitoneum. Depending on where you're working, you might be near the SMA. You got to be careful when you do this. In this case, fortunately, the disease was not too severe. So we're marching, and so I'm showing you a very fast version of what I'm doing, okay? Typically, what I'll do is I'll let everybody fall asleep. I'll grab a beer, whatever, and I'll sit in my home office, which is set up like a mini studio. I have a microphone attached to the desk, which is one of those ball microphones that has the mesh thing over it so that when I narrate, it sounds good. And I will just sit there and I will do this because this is time consuming and I don't want to spend my real day doing it. So I do it when I wouldn't be doing anything else. So we're taking the mesentery, we're just creeping along the mesentery, and this is what you have to do. Unfortunately, there's no getting out of this, and now maybe you guys can see why I don't want to do this anymore. You can see the bowel has started to die because you've taken its blood supply, so we keep going. Like how much time? Well, so we can go to it right here. So this one is, trying to see where it shows it to us. This one is 14 seconds. So I'm looking right here. See that? This is the total length of what we've grabbed. So we've grabbed 1 minute and 42 seconds. This clip is 14 seconds. This clip is 17 seconds. This clip is 12 seconds. All right? Okay. So apparently I've taken all the mesentery now because it looks like I'm now going into the bowel wall. I think that's what's happening there. So you guys, those of you who have seen me do small bowel resections robotically, or like a robotic ileostomy reversal from intra-abdominal side, this is the same technique. I go across the mesentery and the bowel all with the vessel sealer. You don't need to, I don't staple. I don't have two stapled ends of bowel when I'm doing these things because, number one, you don't need those ends to be stapled closed. Number two, if you staple them closed, when you go to make the common channel, now you have to open it. So you have to open it. You have more crossing staple lines. Through trial and error of doing this every way imaginable, I decided that this was the easiest. So I'm coming across the bowel. I'm opening it up. I think I did some suturing. Let's see if we can catch it. Here. Just because I was going to have the specimen sitting in there for a bit, I didn't want anything leaking into the abdomen, which it may or may not have. But since this was not a hard case, we had plenty of time, I sutured it closed on both ends. Because I had opened them, like I said, with the vessel sealer, I sutured them both closed. So that's all that's happening there. So I'm not working with the side that we're going to be making the anastomosis. I was working with the specimen there. Now it's time to do our anastomosis. So I've lined up the portions of bowel. That's me grabbing what appears to be the distal end on the right, and the proximal end is on the left. So you have two open, you see it? You have two open ends of bowel sitting right there. Yes? I think you guys are probably getting a flare for why I don't want to do this anymore, because look how tedious this is. So now the stapler is coming in through a 12mm port, and look, the bowel was already open, so you can just put the stapler in and make the common channel. all right? Before I converted to full robotics, I was doing this laparoscopically. It absolutely can be done. I will show you one part of this case that was definitely easier robotically. So now I'm firing it, and I've made the common channel. But those of you who have worked with me know that because the robotic staplers are 60 millimeters in size, I like to fire it twice. And especially in Crohn's disease, the data has shown that firing a long common channel is what you want to do. So in this particular case, look at that. I made a very long clip there. That clip is 58 seconds long. So imagine, ASCARS only lets you talk for 4 minutes. And that one firing of that staple to make the second part of the common channel is a minute. So you're getting an idea of just how much time this takes. In general, I will go over this timeline that we have now on the bottom. I'll go over that timeline 100 times in order to get it down to the necessary length. How do you what? Good question. We're going to get to it. So that's editing. So the question was, how do you remove? You're talking about how do you make it shorter, right? Yeah, we're going to get to that. So let's real quick just try to finish the procedure here. So, okay, what do we have? We have a common channel that's been formed, and we now have a remaining enterotomy. Our options, as you know now, are to close it either with staples or with sutures. If you have worked with me in this particular situation, I will always choose to staple it closed. And this is what you would be doing on the outside, either with a TIA or a GIA. TA, I never use it. I called it a TIA because I'm having one. You would be doing the, so you would close the common channel on the outside either with a TA stapler, which is completely unnecessary. Why would you open another stapler? You already have one open, or you would just fire the GIA across it. So here what you're being shown is me taking the robotic stapler and putting it across the remaining enterotomy. But apparently I didn't like that, and now I'm fiddling with it. But the beauty of editing is that this whole part, which I didn't pay attention to what exactly happened, but apparently I didn't like the way it looked. So I put it down, and we're going to go again. But with the beauty of editing, you can get rid of all that. We can just skip to when we liked it. So here it goes. Okay. Apparently I didn't like the angle. So I've now made a different angle, and I started by doing less. Okay. So Monique, here's the answer to your question. Now you can get rid of parts of that clip, okay? But you don't have to. In this case, we don't need this. This ended up being we didn't use it. So I'm just going to highlight it. All right, I'm highlighting that, and I press delete, and that clip goes away. So we're not going to use that. Now, we will get to it in a minute, how you do like micro editing, and we're going to get to that. But I want to just show you the rest of this. So now I'm firing it again. Great. Again, we're not using this video, guys. This video is not, I mean, somebody could present this potentially, okay, but not this one. All right, so now it's off. So look, in that clamp that the assistant is holding, that non-robotic instrument, that is what I call the anastomotic edge, all right? And now we have a fully formed anastomosis. So what have you done here? You've resected small bowel, and you've done an intracorporeal anti-peristaltic anastomosis, okay? So what do you have when you do a small bowel resection that you need to deal with? You're done with the small bowel resection, and now you're left with an issue. What is that issue? A mesenteric defect. Very good. So we have one. Now, so remember I said this could be done laparoscopically? It can be done laparoscopically. I don't like to suture laparoscopically. When I was doing these laparoscopically, you know what I would do to close these? I'd get a big clip applier, and I'd bring the two edges of the mesentery together, and I would just fire clips. It worked, but it wasn't super easy, okay? But robotically, look what we can do. We can take a V-lock, and I'm actually pretty sure one of you guys did this. I can't remember who did this. Somebody sewed this thing closed. So look, you can just sew it closed. Now remember, I want you all to remember this. When you're sewing mesenteric defects, you don't need to go full thickness, just take the peritoneum. Okay? We're just going to take the peritoneum because we're just trying to make it scar in so it's closed so you can't get a what? An internal hernia, exactly. So, but you don't need to go full thickness because you can cause ischemia of the bowel, you can cause hematomas, which can lead to problems with the anastomosis. So I'm just sort of skipping around. It got closed. We did this pretty quickly, but just want to point out what we've already done is already almost 9 minutes long. All right, so what am I doing here? What is happening right here? Anyone? By doing what? What are we doing? Yes, so to decrease the tension at what we call, what do people call it? What's the word that people use here? Somebody say it. I'll say it. The crotch of the anastomosis, right? Why do they call it the crotch of the anastomosis? Because I like to stand like this, right? All right. So that's what's happening to the anastomosis. It's going like this, okay? So you can just imagine that when the bowel is just sitting in the patient's body, potentially as you're walking around, especially when you've just made it, that thing can go like this, and these last few staples here are kind of being pulled. So what do? We put a suture there to decrease tension at what I like to call the base of the anastomosis, okay? It's like you will never hear me narrate a video and use the word moist. You will never hear me narrate a video and say the word crotch. It's just, you don't need to, okay? All right, so we put a suture at the base of the anastomosis because we're not animals here, right? So now everything is great, everything is wonderful. Who knows what's happening now? We're just admiring our work. Look at us, we're like, oh, it looks so good. And now what am I doing here? Vista seal. Why do I put it? That is correct. I like to sleep at night. Am I putting it to prevent anastomotic leaks? Well, between just us and whoever's logged on to the WebEx, yes, but not really, okay? The answer to the question is no, okay? If anyone on the boards asks you, why did you put fiber and glue? Forget the boards. You're presenting this video, and Patty Byers says to you, oh, well, why did you put fiber and glue on your anastomosis? What are you going to say? No. No. What is the answer? What do you use fiber and glue for? There you go. Oh, well, hemostasis at the staple lines. That's it. That's what you're going to say.
And what if she says staple lines inside?
Well, I'm looking at staple lines. You can't put glue on the inside part, Thomas. Listen, don't give anybody ammunition, okay? If somebody asks you a question, only answer the question that was asked and nothing else, because they will lead you down a path. All right, so we did the fiber and glue. It's, we're all very pleased with ourselves. We're like, oh, yeah, it looks like snot. Good. All right, that's it. The operation is done. Now, I will tell you, at some point, which we didn't see, I'm sure I did ICG, okay? I'm sure it's there. For whatever reason, we didn't hit on it. Okay, so in that amount of time, we went from, let me see if I can figure this out. Edit, select all. No, it's not letting me. Okay. What I was trying to see was, how long is this clip? I'm sure there's a way for me to do it. However long that was, which probably wasn't all that long, because I will tell you, when I'm dealing with an 8-hour operation and I'm trying to get down to 4 minutes, I can assure you that the first pass was not 10 minutes long, all right? So we are 10 minutes. Great. I think Sage's is 10 minutes, actually. Yes? Something was 10 minutes. ACS, I believe. One of them was 10 minutes. So you have 10 minutes right there, but obviously this is not a complete project. Now, going back to what Monique mentioned earlier. All right, you have a video, it's too long, what are you gonna do? Obviously, in our first pass here, when you get granular, okay? When you get granular and you really start now, so look, I'm just progressing through the video that we made. What you're gonna see is what looked great the first time around, there's going to be a lot of waiting. There's going to be a lot of nothing happening. So here's what you do. All right. What I'll typically do is, you see the line right here? You have a line in between each clip that we have brought down from the top to our timeline. I will press the B button, all right? The B has now turned my selector into a scissor, all right? So I will say, like, okay, here nothing is happening until like right there, all right? So here, from the beginning of that clip to where my scissor is right now, I click, okay? And now I have turned that one little clip into two. So now I will press the A button, or yeah, maybe the S button. B as in boy. Okay. Fortunately, I'm mic'd up, so when you guys watch this later, it'll be good sound. We think, we hope. Timu, we'll see. All right. So look what I'm doing. So this is the clip that we just said we don't need. So I'm going to click it, and I'm going to press delete, and it's gone. Okay? Now, we are running short on time, so here's what I'm going to do. I am now going to go back to the PowerPoint. All right, so what have we done? We have imported the raw footage. We have done the initial editing. That was when we took all of the parts that we said, these are the important steps of the procedure, put them into the timeline. Fine editing, we just did it, okay? We just used the blade and we did fine editing. Now, let us remember, we did it once. You will do it 1,000 times, okay? You will just keep pressing that blade until you get this presentation to the time that you need. And you're going to have to sacrifice some things. You're going to have to sacrifice. So if you have a mesenteric defect, you don't have to show the whole closure. Show the beginning. Always show the beginning. Show a clip of the middle. Show the end. Okay? Because it needs to flow. So pretend that we did that. Next step. Okay. Let me pull this up. I'm going to make this smaller or bigger. I don't know how to do it. So here, I'll have to do it on two separate screens. Okay, so the next step. Let us say that we wanted to, oh good, it's right here. All right, so let me show you a trick, guys. Ready? Here we go. I'm now at the very bottom. So look, we're working now on the top again. Remember I said everything you're going to use first needs to go into the top. That's actually not 100% true, but let's not get advanced here. It's first time. Let's take it slow. We're going to put everything there. So these photos do not come from this video, okay? They worked for what we're trying to achieve here. So here, let's say this was an X-ray. Let's say that's his X-ray pre-op. That's a screen grab of his CT scan. Now, you guys are very good about making your little video clips of the CT scan. That's great. You can make those clips, and you could pop that right in there, and you could show the clip of the CT scan. I encourage you to do that. That is excellent. I usually don't do it because, again, we're working with so little time here. It's typically easier to just, for me to show a screenshot. But if you can fit it in, I love what you guys do with those CT scans. Those of you who have done that, that is video editing. You've already done it. So that's that. Let us say that this was his abdomen. Did it grab? Here it goes. Okay. So now that went to the top for some reason. I don't know why. It doesn't matter. So how do we do this? I just scrolled to the beginning of the timeline here. Okay. It goes left to right, like we're speaking in English. Hebrew would be the other way. But we're not editing this in Hebrew. This is all English. So remember, the CT scan went to the bottom. So what do? You click and pull it down, and you wait until it goes to the end. So we just dropped the CT scan into the timeline. It's now part of our video. And you can, so let's say I wanted to show it longer. I clicked on it. You see how that, like, the arrow thing that's going in both directions? That made me make that photo longer, meaning longer as in it's a static photo, it's not a video. You can make it stand there for as long as you want. So a video is just going to play until you edit it down or speed it up. But a photo, you can say, okay, I want the photo to be there for 3 seconds, I want it to be there for 6 seconds, and I can click on this, And if I want to, I can click on this and I can type in exactly the length I want it to be. What I typically do is keep it long, and then when I'm narrating it, then I know exactly how long I want that to be. So let us go to the end of the timeline on the right. So now over here, we're at the end of the timeline. This is actually working pretty well. I hope you guys are, is this making sense? Okay. So here's the belly, okay? It's not that patient's belly, but this guy did have a right colectomy and the incisions would be similar. So, you know, just for review, when I do my right colon resections, I have 4 incisions and one of them turns into the extraction site. So when you're doing a robotic right colectomy, I get into the abdomen in the left upper quadrant, typically. That incision will become the assistant port. The camera port will be just to the left of the umbilicus. And something I've switched a little bit, remember I'm going to do a fan and steel extraction, and that's, his little fan and steel is hidden away there, it's all here, you can't see it. So fan and steel, I used to put the incision, the port in on the left side of the fan and steel. I now put it on the patient's right side of the fan and steel. It makes the arms work a bit better because now you're sort of going at a nice angle here, just like when I do my lefts where it's really a nice angle all the way across the abdomen. And then the 12 millimeter port, so remember the assistant is over here when we got into the abdomen. I put a 12 all the way over at the flank because when we've done right colectomies, we always find that particularly if we're having to come way across the transverse colon, we're now working pretty close to ourselves. So you want to get that 12 as far away from the working area as possible. So now you've got your working ports that you're working with. You've got a 12 here, you've got an 8 here, that's the camera, and then an 8 here. So it's a pretty good angle. And then if you need the assistant, they can come in over here. So that's what's happening there. So like when they come to the clinic, use your epic, use your haiku, and take a picture of their abdomen. So you can show everybody, you know, like, yeah, this is real. Like this is not, we're not fooling with you, okay? All right, so we've dropped in a video. Now I want to show you one other thing real quick before we turn it into a real video. Okay. Oh, here, this is important. Let me drag this to the bottom here. Noah made this. All right, I tried to get, have you guys heard of Midjourney? I'm going to show you an example of what Midjourney can do. I tried to get Midjourney to show me what my different anastomoses look like, but diagrammatically. So this is a version of an anti-peristaltic anastomosis, right? You have 2 tubes that are brought together like this. So that's a very simplified version of an anti-peristaltic anastomosis. No, I couldn't do it. I tried up and down. So Midjourney is an AI that you can put text prompts in and it will give you pictures. And I'm going to show you what it can do. And I'm going to show you something awesome. But I could not get Midjourney to do this. So fortunately, I have a 17-year-old who is a great artist, and he made that. So look what we can do. This is great. All right. So let's go to the part of the operation where we were doing that, right? Okay, right here. You see the stapler going in, so you know that's where you're making the common channel. So you're making your common channel. What you can do is you can highlight this, and you can press Q. And look what it did. Okay? You see it there? All right. This is bonus. All right? Now, what's funny is that when I was first doing videos as a fellow, that's when I learned, the person that it was like a college kid, he was doing this, and then I forgot about it for years. We're going to do picture in picture. All right? So I highlighted this, and I already had put my marker here. That's how it knew it. I put my marker here. That's the red line. Then I went back up here and highlighted this, and I pressed Q, and that brought it back. That brought it to the timeline. Now this is where things get a little bit complicated. You have to click this, and then let's see if I can make this work. I will tell you that when I do this, sometimes when I'm doing complicated stuff like this, I have to go to YouTube, and I have to type in what I want to do, and I have to watch a quick YouTube video about how do you do picture-in-picture again. So let me see if I can do it real quick. So I click this, and then I press this. This is the transform button. Come on. Oh, okay. My marker wasn't on the picture. So see this red line? That red line is what you're seeing on your screen. My red line was over here. So it's showing me what is right here. The red line is here. Okay. So you have to put the red line there. So now we're seeing that. Okay. So now I have pressed the transform button and watch what I'm going to do. Look what I did. Okay. Now there's apparently there are all sorts of things that you can do here. You can like change the shape of that. You can make it semi-transparent. There's a whole lot that you can do. And I invite some of you, like if you're doing this and you're splitting up the work, what you should do is you should be like, okay, you're going to do all the picture-in-picture stuff. Go watch the YouTube videos, find out all the tricks so that when we have this, you can then fiddle with all this part and do that. If you're all working simultaneously, you can make amazing videos. So I can put this anywhere. I'll put it here. Okay? So now watch. Watch what I'm going to do. I'm going to click this and I'm going to elongate. Because remember I said with a photo you can choose what to do? So look what I did. Now, watch this. Watch how cool this is. I'm going to press play. I'm going to make it full screen. Watch what happens. This is great. I just spoke at a conference like 2 weekends ago or whatever, and I'm going to show you. I showed this kind of thing, like what's happening in the abdomen, and then I had somebody in here take videos of me, right, at the console. There you go. So here, this is a great way to explain to somebody what is going on here, because now you're seeing the stapler go in, you're making the common channel. This is an anti-peristaltic anastomosis done intracorporeal, but like it's maybe sometimes easier to visualize it. Is it not following me? It's all right. Oh, okay. Thank you. Then just keep it off. So we have the diagram version, okay? Yes, and I'm going to do that right now. Okay, so quick little thing. You see how the red line is moving to the right? All right, it's going to keep playing. Just press the space bar and it stops. Okay. So now we have that. Now, I'm going to get this ready, so I'm going to scroll. Remember, that's our repository. That's where everything goes. I'm going to go here. I'm going to go here. And I have pictures and movies, but you can add both. Let's just do movie. I'm going to drag it. So now I have it there. So now I have that. So remember, the red line is where you're going to put something. So I have the red line where I want it. I'm going to highlight the new video. I'm going to press Q, and it pops up right there. I learned that from YouTube. Okay, now remember, that's a video. You can't elongate it. So however long that clip is, that's how it's going to be. So now we go here, and we have to put our red line. We go here. Obviously, that doesn't look great, right? So make it smaller. So little Michael. All right. So little Michael is in the corner, just like in the operating room. All right. Stuck in the corner, always. Okay. So now here's what this is going to look like. Now, obviously, I didn't like. Thank you, Thomas. So there I am. Okay. So there's. Now, obviously, you want to try to match what you're doing there to here. So because obviously nothing's moving. Okay, but that's not the point of this. The point of this is to show you how to do it. Okay. So that was cool, and I very much encourage you to do that, because I will tell you that if you have not seen robotic surgery, my kids have seen 1,000 of these videos, okay? But until recently, they had never seen what I looked like doing it. And so when they saw that clip, they were like, wow, that's not at all how I envisioned it. And if you look at it, what's that? No, what I did, you should keep that the right. So I would encourage you, if you're going to do that, show the outside part at normal speed. Show the inside part sped up. Now let's do that, because that's one of the last things. Okay. I'm gonna go here. I'm gonna hit edit. I'm gonna go to select all. Okay, it's all selected. Okay, the entire timeline is selected. Its current length is 10 minutes and 15 seconds, but that's way too long. So now you see this thing that looks like a timer? Go to the timer. Go to custom. How fast do you want it to be? Let's make it real fast. No, I will tell you, you'd be shocked. That will just look, you can't believe how slow we operate. All right. So here's what I'm going to do. I'm going to make it 500%. All right. So now it is much shorter. This part, I knew how to do this last when I did it. Here, I can go here, I think, and I can go here, and I can go to normal. There. I made the clip. I made that the normal length. The little box, I don't know where it went. Oh, there it is. And it looks much, see how long that looks now? That thing looks so much longer. Okay, I want to show you one more thing. I want to show you two more things, okay? Because you need to know this. Two more things, and then we'll watch the video. All right, so we're in PowerPoint. So this is important. I have the slides. I have this, okay? These are like the slides that we use because they have the MHS stuff on it, MPG. I'm not going to bother too much with this. Let us just say the following. You cannot import PowerPoint slides into your presentation. You cannot do it, okay? You need to do the following. You go to File. This is very important. You go to File. You go to Export. You go down here. You go to JPEG. Okay? Now I have to remind myself because I learned something new last night when I was making this for you. Sorry. I have to cancel this out real quick. Where's the other one? There. Okay. See, I even made it, but we haven't been looking at it, but I made you a PowerPoint. Okay, here's something I learned last night. I've always had this problem and I fixed it, but I think I can fix it even better. When you do what we're about to do, which is export each individual slide as a JPEG, because remember, we were putting photos into the timeline because they were JPEGs. You can put JPEGs in there. If you put it as the regular resolution that it comes up as, when you turn it into a video, you're going to be looking at this awesome HD or 4K video, and then all of a sudden, when the slide comes up, it is going to look like garbage. And the reason is that it is set to do a low resolution JPEG. So I've been doing it at 1280. Is that what it is? HD? Is that 1280? Okay. Well, I learned last night that you can go as high as you want. It's all in the same format. This is made for widescreen. So instead of 1280 or 1080p, whatever it is, let's go to 4000 by 2250. That's what. Remember that, please. 4000 by 2250. You actually only have to remember 4000. Okay. So we go back to File. We go back to Export. And before we forget, we're going to go to JPEG. And the width is the 4000. Okay. So look at the numbers that are there, right? Look how low that resolution is. And it took me so long to figure this out. I have videos going back where nice video, crappy slide. This is why. It was 4,000. 4, 1, 2, 3. Press enter, and it did it automatically. Each slide in your presentation has been saved as a separate file. Okay? So now what we can do is we can go back here to whatever folder we were using. I'm just going to close this. We don't need it anymore. I'm going to go here. I think where did it put it? I think I put it here. There. So see what happened? It made a folder and it turned every one of your slides into a JPEG. Now you can go back to Final Cut right here and then pull up your Finder window and we'll just do one, okay? So I always have the same format. I do the title at the beginning and the title at the end. So what will I do? I will take this and I will drag it to the very beginning right there. And then I will do it again at the end. And then one thing, and then we're done. And we're going to make the video, and then that's it. I think this has gone well. Okay. You go to View. Sorry, you go to Window. Now, what's the last step? What have we not done? Correct. So this is how you do it. And this is where I look hilarious in my home office with the microphone. So you go to, so you say okay. Okay, let me start again. I went to Window. I went to Record Voiceover. Click it. The box comes up. You can put it like where you can move it, I think. You can move the box wherever you want. So now it's out of the way. Now, how do you do this? So remember, the red line is where you're going to put something. So if I have the red line right here, that's where it's going to start recording from. So watch how this looks. I don't know if it's working or not. Remember, the sound wasn't working before, but just pretend. So it's picking me up. You can see it's picking up my voice because you see the green bar is going up and down, so it's hearing my voice. So it's going to count down. So here's how this goes. This is a video. We're editing videos. We're waving our hand over here. But what we're really doing is editing the video over here, but we're completely distracting you here. And we're editing the video over here. All right? Because while you guys have all been looking over here, I've been making a whole video over here, and you didn't even realize it was happening. All right. And there it is, right there. Okay? So that's your narration. Now, I will tell you, and I don't think it's going to happen here, when I click my magic trackpad at home, it makes a sound. And on every single video clip that I make, you hear a click, and I have to go in to every one of those things, and I have to like move the bar and get rid of it. I hope our WebEx didn't just stop, but something just happened to her computer. Let's see if we can. Oh, I think I found why the sound wasn't coming. Over here, but what we're really doing is here, but we're completely distracting you. Here, and the video over here. All right? Because while you guys have all been looking over here, I've been making a whole video over here. You didn't realize it was happening. All right. Final step. We did it. We made a whole video. I'm pretty happy about this. I thought this was great. All right. So we're done, and it's 2 minutes and 30 seconds. I think we can sit here for 2 minutes and 30 seconds and watch it, right? Okay. So final step. You go to the upper right, that share little icon, right? Click on it. Let me move this. All right. You have a bunch of different choices here. I don't know exactly what they all mean, okay? This will give you 1080. This will give you 4K. This will give you a resolution that's like easy for Facebook and YouTube to handle. I've tried all of them. It's fine. But what you can do is you can just click the first one and go to Export File. And now I will go to Settings, and I will make sure that it says the following. No, it doesn't come over. Okay. When I do it on my computer at home, it gives me different options of choosing whether I want it to be a fast encode or higher quality. Always click higher quality. Okay. Then you click, so it's all done. That's done. Click next. Let's see how fast this computer can do it. All right, this might take a minute. While it's working, who has questions? Like you mean? Mm-hmm. Surprisingly, by the time you're done, it's usually about like a gig. It can be less. They know that these videos are of that size, so they're set up to handle that. Occasionally, you will have a problem uploading, and just try again. If you have a problem, you just call them, and they'll give you some workaround or something. Yeah. Yes. And I actually there is one part that there is one part that I skipped while it's making the video. Let me review. All right, so it made a video already, guys. All right, it made a video, but before we do that, I will here. Let's watch the video, and then I'll address two things. I'll address that question once again. I'll show you how to make it faster. And you know what we skipped because I wasn't following the PowerPoint that I made for you? We did not add transitions. This is a video. We're editing videos. We're waving our hand over here. But what we're really doing is editing the video over here. But we're completely distracting you here. Editing the video over here. All right? Because while you guys have all been looking over here, I've been making the whole video over here. You didn't realize it? All right. So it's not just to be clear, it's not choppy over here. It's choppy here because we're streaming on the WebEx. It's fast, okay, because we made it 500%. But going back to what we were talking about before, we are now working at 5 times speed. And I will tell you that the truth is, I would not really want to watch this much slower than that, okay? So this is a great learning exercise. The movements that we are making in the operating room, they are slow. Even when we're thinking that we're moving fast, we are moving slow. And you know what? That's okay. Because it is not a race. It doesn't matter if the operation is over in 22 minutes and 36 seconds. The operation is over when it is over. So let's all take a pause here for a second while we're watching the video. I don't know why that maybe. So hopefully no one's saying anything back there. There's audio on that. You can get, yes. So there is a way, another advanced maneuver. There is a way to detach audio clips. So you click on a video clip. So something like that. What I would have done is I would have clicked on it, and I would have double clicked, and it would have given me the option to detach audio from video because you don't want the audio there. And then it'll show you the audio, and you just delete it. So that's an advanced maneuver. If you run into trouble, just call me. But look, we're running at 5 times speed here, okay? So what I was saying was, even when you're working fast, you're working slow, but you're not working slow, you're working at the appropriate speed. And maybe you're faster or maybe you're slower than somebody else, but it doesn't matter because you're working at the speed that you need to be working at to get the job done. Because speed is, in almost every situation, the least important factor in the operating room. Yes, do we want someone there for 8 hours when something could have been done in 1 hour? No. But if it takes you 2 hours to do something when it could have taken someone maybe an hour and a half to do it, doesn't matter as long as you did a good job. So you made a video. So let's do so we sat here and we did an entire surgical video. So that just shows you that you 100% can do it and I don't have to anymore. All right. Yeah. Okay, so let's go back to one thing. How did we make it faster? We selected the entire timeline and we went to this thing. It looks like a stopwatch. And I clicked it and I chose custom speed and I chose 500%. But we could have chosen anything. Now, the other thing is this. You don't have to choose the entire timeline. You can choose a segment of the timeline and you can make that 200%. And you can choose a different segment of the timeline and you can make that 500%. So like, maybe when you're making the anastomosis, maybe you do that at like 300%. And then maybe when you're closing the mesenteric defect, maybe you make that 500%, because then it'll look like you're just suturing it closed. You get to show the whole thing. Wonderful. So we did that. Now, look over here, right here. Do you see my arrow? I'm going to click it. Those are our transitions. I forgot to show you this. The one most commonly used by me and probably by most people is this very first one. That's why it comes up first. It's called cross dissolve. So this means that instead of the clip just going clip, 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 you can have it so it dissolves from one clip to another. So you just drag it. Now there must be a way to batch this. I've never been able to figure it out. I've never been able to figure out a way to like put a clip, choose a transition and have it automatically put the same transition in every clip, because I mean, who knows how many we have here? And I mean, we can try it. So edit, select all, edit, select all. Okay. Nope. I was going to give you $5 if that worked, by the way. Okay. We talked about Mid-Journey. We talked about Mid-Journey. So let me show you this. All right. Look at this. So Mid-Journey could not and would not make a diagram. Okay? So Mid-Journey couldn't do this. So I said, diagrammatically, in simplified fashion, show me an anti-peristaltic anastomosis. Something like that. And like, you would not believe what it popped out. It was absurd. But what will Mid-Journey do? Mid-Journey will allow you to say, there is a 40-ish-year-old surgeon in an operating room. He's handsome. He has brown hair. He wears thick, dark glasses. And he's done in like a robot chicken / claymation / whatever style you want. And Midjourney can do that. The stethoscope was a bonus. It gave me the stethoscope. And for the life of me, I couldn't get it to make the scrubs black. And I could not get it to tuck the shirt into the pants. But I mean, you have to admit, like, why is Midjourney able to make a claymation version of me, which is a pretty reasonable representation of me if I were on Robot Chicken, but I couldn't tell the damn thing to do that? Do you think I didn't try that, Thomas? No, I tried to simplify it every which way, and I couldn't get the computer to do it. I'm going to keep trying. I'm paying $60 a month right now to try to make it work. Okay? I'm paying $60 a month to try to make that AI make those two tubes. Okay, so as many of you have heard me say at multiple meetings, I have asked GME to purchase a Mac for our residents, who are you, which will include Final Cut, so that you guys could at least have access to a computer that has it, and you can work on it here. And it hasn't happened yet. Now I'm going to actually make an invoice, and I'm going to give it to them. Okay, I'm going to take that final step. I'm going to try to cross the line for you. I'm going to make an invoice. I'm going to build the computer. I'm going to make an invoice, and I'm going to say, please, okay? Because I want you to do it. Now, I started using Final Cut later in my process. You can do this with iMovie. You may not have all the bells and whistles that I can do with Final Cut, but you can do it with iMovie. You know what iMovie costs? $0. All right? So there's no barrier to access. I am sure that if you are a Microsoft user, there are ways to do this. I am unfamiliar with them because I've been using the Mac now for so many years. Any questions before you guys go have lunch? All right. Good job, guys. I'm going to de-mic myself.